and Assalamualaikum to Madam Ain and my fellow classmates. Today, my group represents Chapter 7, which is Ergogenic Aids for Sport Performance. Are you ready? Let's begin. According to an anthropologist, ergogenic aids are substances, technique, or material that are work endangering or performance enhancing. It means that a group of substances, products, or regions that can be manipulated to improve performance. In simple words, ergogenic aids is products that improve performance. In the context of sport area, it is supplement or ingested substance that is prohibited by the letter or the spirit of the rules, but it is used to garner an advantage in the sport experience. Why athletes take ergogenic aids? Because ergogenic aids will improve an athlete's physical and psychological to have a better performance in the game. It will remove subjective restraint that which limit their physiological capacity. But need to alert, many sport governing organizations and many athletes classify the use of ergogenic aids as cheating because of the fraudulent and deceptive behavior.
According to Melvin Williams, there are 5 kinds of ergogenic aids, which are pharmacological aids, psychological aids, mechanical aids, physiological aids, and nutritional aids.
Okay, let's move to the first types of ergogenic aids, which is pharmacological aids. It can be defined as a drug that are designed to influence physiological and psychological process to increase physical power, mental strength, and mechanical age. They are more supplement types form that can be bought over the counter and are legal. They are variety of drugs that are used by many to help their performance in athletic and workout performance, but must be careful in use to do possible harmful side effect. For example, pharmacological aids is paracetamol, creatine monohydrate, amphetamine, and anabolic steroid. Numerous drugs has ergogenic properties. The IOC and the NCAA and several other sports governing bodies have extensive list of banned substances. Most of them are in pharmacological agents. The second type of ergogenic aids is psychological aids. Psychological aids are used to help the athlete or individual prepare mentally to be focused. This not supplement to be taken, but rather the activities that are done to get your mind in the proper mental state. For example is music, warm-up, imagery, cheering, and yoga. Music. Why music help in psychological aids? Soothing music can calm a pre-gamer's jitter, while energetic music can pump you up before an event. Second is warm-up. Stretching has been shown as a common warm-up and results have shown to reduce soft injury. And the third one is imagery. Imagery, it involves positive visualization including seeing yourself winner in the game. The fourth is cheering. Cheering is having affirmation from friends or family which can improve the mental state of the athlete, resulting to improve their sport performance. And the last one is yoga. Okay, move to the third types of ergogenic aids, which is mechanical aids. A mechanical ergogenic aids is any kind of fitness equipment that can be used to help an athlete train a specific targeted area of their fitness or improve athlete performance. For example is sport clothing, treadmill or weights. I want to give you a better understanding in mechanical aids. Clear case of mechanical aids can be seen in swimming. Do you know Mark Spitz or Michael Phelps? Both are famous in swimming sport. Okay, Mark Spitz won 7 gold medals in the Summer Olympic in 1972, an achievement only surpassed by Michael Phelps in 2008. However, Spitz set a new record and in all 7 events in which Michael Phelps competed, a record that still stands. Because of why? Because Spitz swam with no goggle, no caps, unshaved body and a tiny little speedo bathing suit. In contrast, Michael Phelps won his 8th medal in the Olympic because he wore fat skin LZR racer mode, which is made from a high technology swimmer fabric composed of woven elastane and polyurethane. Interesting thing that I want to share to all of you is, do you know what? When the LZR swimming suit was launched in a week, 3 world records were broken by a swimmer wearing the suit. 98% of all medals won at the Beijing Olympic were won by swimmers who wearing the LZR racer mode. Okay, we move to the 4th types of ergogenic aids, which is physiological aids. Physiological aids to performance are substances that occur naturally in the body, which improve the body response to exercise when they are increased to higher than normal level. Any activity that have been designed to relax, stretch or works various parts and athlete's body. Okay, I will give 2 examples in physiological aids in legal or illegal. Okay, the legal one is a sports massage. Massage is the most effective therapy for releasing muscle tension and restoring balance to the musculoskeletal system. Receive sport massage regularly. This may help athlete prevent injuries. Other than sport massage, we can also do a physiotherapy. The second one, which is illegal, is blood doping. Blood doping illegal because it involves putting extra blood into the body, which increase the level of hemoglobin, thereby providing an increased oxygen carrying capacity for delivery to the working muscle. Okay, the last one, the types of ergogenic aids is nutritional aid. What is nutritional aid? Nutritional aid is organic substances or as a potential energy sources. Nutrition ergogenic aids can include anything from manipulation of the fluids, carbohydrates, fats and protein content in a diet to nutrient or food supplement. We can see nutrition aids in the forms of tablet, liquids, bar, injection and or powders. In other words, it is described as a various foods or drink substances that are legal to use and can be helpful in aiding the athlete's performance. For example, the nutritional aids consist of beetroot juice, nitrates. Second is carbohydrate loading, and the third one is sports drink. I'm very sure that most of you have been sport drink during your training, exercise, and even in game. Okay, that's all from me to briefly explain the definition of ergogenic aids and the types of ergogenic aids. I will pass the baton to the next presenter, Nur Afika.
So now let's proceed to uses of ergonics. First is stimulants. Stimulants are used in sport to enhance performance. This substance works on the central nervous system to increase alertness, concentrations, metabolic rate, power, strength, and decrease fatigue. So this is make persons feel more awake, alert, confident, and energetics. First, we are going to amphetamine. Amphetamine stimulates drugs which mean they speed up the message traveling between the brain and the body. Amphetamine has been treated for the wide variety of conditions. Now, it is mainly used to treat attention deficit hyperactivity disorder, or more known as ADHD, and rarely depressions. In the past, it has been to help with weight loss, but this is less common now. And then the second one, we are going to ephedrine. Ephedra is a popular herbal supplement that has been used to increase fat metabolism and overall sport performance. It works by enhancing the body's productions of adrenals. The third one is cocaine. So basically, cocaine is a strong central nervous system stimulant, and it is the most potent stimulant of natural origins. Contrary to the popular belief, cocaine does not improve overall sport performance and has several addiction potentials. Several studies have shown that cocaine has no beneficial effect on running lines and reduce endurance performance. And then now we are proceed to caffeine. Caffeine also well known among the students, right? So caffeine is a performance enhanced stimulant found in numerous products that we are consumed every day, such as soda, workout supplement, tea, chocolate, and coffee. It has been shown to increase reaction time and delay fatigues in sport like taekwondo sport. And then we are proceed to nicotine. Nicotine is considered the most widely used psychoactive substance in the world. Nicotine, it is more potent and more addictive than the caffeine before. In the sporting world, particularly in team sport, between the third and the half of professional athletes are using nicotine also. Sport people claim that nicotine itself it helps to prevent the dry mouth or control their body weight and improve the concentrations and attention itself. Now we move on to second uses, depressants. Depressants is slow down the central nervous systems. When you take in small doses, it may affect sections of the brain responsible for our conscious and voluntary actions. But when you take in the large doses, it acts on areas that govern automatic functions like breathing and heart rate. For the example, you take marijuana, alcohol, inhalants, prescriptive drug. So now we proceed to the third uses is anabolic steroid. Anabolic steroid is natural or synthetic derivative of testosterone that are responsible for the masculine and muscle building responses in the body. Basically, anabolic steroid has two types. The first one is orally active. This is medically used for maintaining secondary sexual characteristics. Dose of 15 milligrams per day. An athlete may use dosage of 300 milligrams per day. For example, Yanabol, Inava, and Drol. The second type is injectables. Clinically used for rare disease and men with the low sperm counts. Typically doses is 250 milligrams up to 6 months. Athlete may use this dosage of 1000 milligrams or more per week. Some injectables stay in the body for 1.5 days and others up to 3 months from single injections. So, what is effect of anabolic steroid? It may increase lean body mass in both men and women, increase water injections, No substantial proof that anaerobic performance is improved. No proven benefits to aerobic athletes. Increased aggressiveness, health risks, including abnormal cholesterol profile, liver tumor, and also increased skin problem like acne. So now we proceed to the next uses. Human growth hormone. Human growth hormone, also well known as GH, has a number of acceptances medical uses, but it has quickly become a popular ergogenic aid among the athletes. The issue of performance enhancing substances such as anabolic steroid and GH has drawn the attentions of athletes, their parents, and also their politicians. On almost a daily basis, headlines about the status of doping in professional, international, and amateur sport seems to be more pervasive. The suprapsychologic effect of GH leads to lipolysis with increased muscle volume. In the same time, it may help to boost muscle growth, mobility strength, and increase the exercise performance. It also may help an athlete to recover from their injury and disease. Let's proceed to the next uses. Blood doping. Blood doping is the certain technique and substance to increase one red blood cell mass, which allow the body to transport more oxygen to the muscle and therefore increase stamina and performance also. There are three widely known substance or method used for blood doping, namely is EPO, synthetic oxygen carrier, and blood transfusion. Now, let me explain about the EPO first. EPO is a peptide hormone that is produced naturally by human body. EPO is released from the kidney and at the bone marrow to stimulate the red blood cell productions and increase the red blood cell, improve the amount of oxygen that the blood can carry to the body muscle. It may also increase the body capacity to buffer lactic acid. So what is effect of EPO? While proper use of EPO has an enormous therapeutic benefit in the treatment of anemia related to the kidney disease, its uses can lead to serious health risks for athletes who use this substance simply to gain a competitive edge. It is well known that EPO, by thickening the blood, leads to an increased risk to several deadly diseases such as heart disease, stroke, and cerebral or pulmonary embolism. The second type is synthetic oxygen carrier. Synthetic oxygen carriers such as hemoglobin-based oxygen carrier, HBO or PFC, are purified protein or chemical having the ability to carry the oxygen. Synthetic oxygen carrier appear useful for emergency purpose when human blood is not available. The risk of blood infections is high or when there is not enough time to proper cross-match donated blood with a recipient. However, for doping purpose carrier, the risk of cardiovascular disease in addition to various serious side effects. The third type of blood doping is blood transfusions. So there are two forms of blood doping, autologous and homologous. Autologous blood doping is the transfusions of one's own blood which has been stored in refrigerated or frozen until it really needed. Although homologous blood doping is the transfusions of blood that has been taken from another person with the same blood types. Although the use of blood transfusions of blood doping dates back several decades, its recent resurgence is likely due to the introductions of infectious EPO detection method. Now we proceed to the last uses is beta blockers, also known as blocking agent, medications that reduce your blood pressure. Beta blockers work by blocking the effect of the hormone epinephrine. Beta blockers can cause your heart to beat more slowly and less the force, which lower the blood pressure. Beta blockers also help open up your vein and arteries to improve the blood flow. Actually, beta blockers are not recommended as the first treatment if you have only high blood pressure. Beta blockers may not work as effectively for older people, especially when taken without other blood pressure medication. Beta blockers are used to prevent, treat, or improve symptoms in people who have irregular heart rhythm, heart failure, chest pain, heart attack, migraine, and certain type of tumors. The side effect of beta blockers can make you cold hand or feet, fatigue, or weight gain. While the less common of beta blockers is depression, shortness of breath, also trouble sleeping.
So we move on to the what is drug testing. So drug testing or drug screen, also known as anti-doping testing, is the process of collecting and analyzing samples of blood, urine, sweat, hair or saliva to detect the presence of illegal or banned drugs and prescription medication in the body. So the main function of drug testing is to detect the presence of illegal drugs, prescription medication and non-prescription medication. So what is non-prescription medication is the medication is not prescribed by the doctor and it is directly being sold to the athletes. And also prescription medication is a medication that is prescribed, but it can also be a problem to the athletes because some athletes take excessive amount of drugs and they also crush the pills and inhale the pills instead of swallowing like the normal way or as directed by the doctor. Next, the test is conducted to ensure that athletes are not using performance enhancing drugs in sport or athletic competition to gain an unfair advantage over their competitors. So the drug testing is to ensure that athletes compete in a fair play competition and no such thing as cheating. Now we move on to the important part, which is the dilemmas of drug testing. So the first dilemma that we want to highlight is the opposition to drug testing. So the first one is opposed mandatory drug testing. So athletes oppose. They are against, they disagree with drug testing. Why? Because most athletes consume ergogenic aids to enhance their performance, and on top of that, they have to be extra careful with the choice of food to their hair care product because those things might contain illegal substances. So if they do the drug test and the result is positive, they might be suspended or banned because of those illegal substances, even if they are innocent, but the result proved that way. Next, athletes argue that they are being singled out from junior students for drug testing. So athletes say that they are being picked on just because they do the drug test. Because people believe that if you're being called for a drug test, you are definitely taking the drugs, which is not accurate and it can be twisted because athletes want a clean name, a clean reputation. So the third one, must establish a rational basis or compelling state of interest for drug testing program. So the authority or national governing body, for instance, Malaysian Anti-Doping Agency, ADAMAS, they need to give rational reasoning or justification so that the athlete could accept the importance of drug tests. Compelling state of interest is referred to the methods to determine the validity of drug tests. For the last position to drug testing, athlete is required to do drug testing as a prerequisite to compete in athletic competition. So it is a required condition. It's a requirement to do the drug test before joining the competition, or else they can't join the competition. So the second dilemma is thwarting drug testing. So thwarting is how the athlete passed through the drug test. So drug testing only able to detect the specific and banned chemical components. So there are certain drugs that cannot be detected with drug testing. Athletes know how to avoid being caught by cycling on and off the banned drug. So athletes definitely know how to remove the drug inside their body before the drug test. Third one, taper off before competition and not test positive. So the illegal drug will decrease over time before the drug test, so the result will be negative. Lastly, they take other drugs that mask the banned drugs. So athlete consume other drug that is not in the prohibited list so that they can cover up the banned drug they are using. So the testing couldn't detect the prohibited drugs. Another dilemma that we wish to emphasize is justification of drug testing. So sport organization or authority knows best for athletes in society. So the authority need to protect the health of athletes and ensure respect for ethical concept in competition. Next, competition will be fair for each athlete by banning ergogenic aids. So drug testing is one of the essential components to protect clean competition. Clean sports. Finally, the last dilemmas, which is education against drug use in sport. Introducing more education to discuss the good and the bad of ergogenic aids. Second, education can convince athletes about the reality of health risks associated with drug use. So most athletes willing to take drugs because they perceive that those illegal substances would help them to consistently win. So with the right education, they would understand the side effect of ergogenic aids.
Thank you, Nabila. Now, my turn to explain other related issue on the ergogenic aids. From all the explanation from types, uses of ergogenic aids and drug testing, we can know that many other bad subsequent to individual, especially the male and female athletes. Weight gain and loss. Firstly, this might cause weight gain and loss. Consuming ergogenic aids like creatine usually might cause increased weight because it does tend to promote water retention as well as diarrhea and abdominal discomfort. But there are several supplements that specifically can reduce the weight, which fat burner. Even though we know the capability of fat burners can reducing weight, but using too many natural fat burners, especially supplement, can lead to acute liver failure as well as nausea, anxiety, panic attack, and also high blood pressure. Other than that, ergogenic aids, which medical cannabis, can be especially helpful for the goal of weight loss also. You may already know that one of the main characteristics of cannabis is it can increase your desire to eat. However, what you probably don't realize is there are also strains that can help you lose weight. Sure, marijuana often associates with the munchies, which could indeed lead to weight gain. But some studies indicate medical marijuana and weight loss are possible. First, let's take a look at how marijuana affects the body. Your endocannabinoid system (ECS) plays an essential role in your body beyond interacting with cannabis. Your ECS is not just a natural part of your body, it is a vital one. Marijuana and its two main cannabinoids, cannabidiol CBD and tetrahydrocannabinol THC, have medicinal properties. Your body is continually working to monitor essential functions and levels in your body. When something operates outside of the proper range, the body immediately activates the ECS to correct it. For example, when you become hot and begin sweating, it is your ECS that works to cool you down. If your stomach starts to growl, that's just your ECS reminding you to eat. No matter how much smoking of medical marijuana for weight loss you do, and no matter what strains you use, consuming a large number of calories every day without burning them off will lead to weight gain. The demand of coaches and the competition. By joining in bodybuilding sporting arena, as everyone know, to maintain the athlete body in shape are the requirement. The demand is impossible for the athlete who does not applying the ergogenic aids. While this ergogenic aids is actually helpful for enhancing athlete performance. Causes of the health problem. Side effect from high doses of ergogenic aids may include allergic reaction, central nervous system, and gastrointestinal disorders, and also kidney damage. The Dietary and Supplement Health Education Act puts the onus on the Food and Drug Administration to prove that supplements are harmful. The most harmful is the anabolic steroids and epidurins are two ergogenic aids that have been studied extensively and that have definite adverse effects. So, the side effects that are relatively reversible include decreased sperm production, infertility, male pattern baldness, gynecomastia, acne, and also increased rates of hepatic cancer. Anabolic steroids have been implicated in altering lipoprotein profiles with increased low density lipoprotein LDL levels and decreased high density lipoprotein HDL level, thus increasing the risk of atherogenic changes and cardiovascular heart disease. Anabolic steroids can also increase both systolic and diastolic blood pressure, especially at high serum concentration. Finally, these substances are mind-altering. Psychiatric changes sometimes associated with anabolic steroid use include depression, aggression, hostility, and also paranoia. These are often referred to as the steroid rage. Other ergogenic aids that we would not be recommended, but getting more than you actually need doesn't provide extra benefits. However, if you are taking vitamin mineral supplements and they are diverting deficiency, they can absolutely improve your actually performance. This is because anabolic steroids is actually illegal by every major sporting organization. Lastly, other related issue might be possible changes. The first possible changes is actually starvation diet. So by doing the starvation diet, is the athlete can be anorexia and also bulimia. This can be applied to the bodybuilding sporting event, as they are needed to maintain their shape in at least body fat low 10%, so that is to they are being in the peak of performance as well as to maintain their performance. Other than that, the possible changes is exercise in rubber suits risk dehydration. So by exercise in the suit will cause dehydration. So inadequate calcium intake also can make the athlete the effect of the osteoporosis. In order to take the supplement, athletes are ignoring this calcium intake that might be osteoporosis happen to their bones. So this osteoporosis will affect in their long term, especially to their career. So by ignoring the inadequate calcium intake, this might affect their career as long as their athlete performance. Next, athlete maintaining abdominally smaller food intake, which cause amenorrhea. This diet is also quite worse when the athlete consuming smaller intake to their diet. This will might amenorrhea.
The first case study I will take from local sport news adult from New Straits Times, which is diver Wendy Ng fails doping test, will be stripped of KL 2017 gold medal. What? Gold medal from Malaysian diver was stripped? Who? Wendy Ng is a Malaysian diver from Kuala Lumpur. why strip gold medal fails a doping test where in SEA Games Kuala Lumpur when August 2017 and how subratamine was detected in doping tests.
Okay, do you know what is sibutramine? Why have sibutramine can be banned in joining any games in sport? Okay, sibutramine is indicated for the management of obesity, including weight loss or maintenance of weight loss, and should be used in conjunction in reduced calorie diet. Sibutramine is no longer available in United States because the risk of serious cardiovascular system in some people who use the subratamine agents. Sibutramine is not performance enhancing drug and is mainly used for weight loss, and the main reason is banned because it can be harmful to health. Amateur Swimming Union Malaysia ASU Wendy Sample has test positive for the banned substance subratamine by the World Anti-Doping Agency at its laboratory in New Delhi. But even Wendy Ng is stripped the gold, Malaysia still keep the gold medal in the 3-meter springboard event as Nur Dabita Sabri will be promoted at the first place. Dabita originally finished behind Wendy in 3-meter springboard individual event. But however, Malaysia will lose the gold medal won by Wendy and Dabita in the 3-meter springboard synchronized.
So we would like to briefly explain about the international study case. The study case is runner banned from Olympic trials blames burrito for failed drug tests. So the runner, who is Shelby Houlihan, is an American runner. She is currently facing a 4-year ban after testing positive for performance-enhancing drugs and will be barred from competing in Olympic Tokyo 2020. So the drug found in her body was steroid, and she claimed that she never took any illegal substances, especially steroid, because it is only for bodybuilder and she is obviously a runner. So she claimed that she ate a pork burrito 10 hours before her drug test, and eventually she was tested positive. But she gave her hair sample for the second test, which is the hair drug testing method. So the result showed negative, but the authority believed that the first test was accurate. So there are two perspectives from our side. The first one is the athletes must be very, very careful with their choice of food to their hair care products, because those things might contain illegal substances. Even if they are innocent, they will be tested positive in the end. And the second perspective, with newer technology, the drug test will prevent cheating in sport, and the authority will work harder to make sure that all competition will be played fair and square.
Lastly, the conclusion is the use of ergogenic aids threatens equity or the concept of fair and just. Athletes, coaches and also trainers need to examine their personal belief and values and also determine what actions are fair, just, honest and beneficent. The education must be included in their training program, which is especially for the male athlete and also female athletes, so there is awareness among them to not maintaining or also consuming the ergogenic aids with high doses, as well as many bad long-term side effects to the athletes, especially for the long term and also their career as a professional athlete. Next, sports leaders have the obligation to educate themselves and their athletes morally, and not to abdicate this responsibility to a governing body that may only mandate drug testing and not educating morally. The importance from the school level of awareness ergogenic aids, so that the athletes from the both gender, male and female, are born with this education and also awareness, while avoiding them to consume ergogenic aids with high doses. Governing body of sport should pay more attention to this issue, as well as ban the athlete participation when they are suspected of high doses of ergogenic aids. That's all from me. Thank you.